Today we're here with Shirley Russell. Shirley has a master's degree in psychiatric nursing. She also has 24 years experience in working in hospital-based psychiatric settings and chemical dependency treatment centers, as well as in home-based counseling work with individuals and families. And for the past 6 years, Shirley's been working at Midcoast Hospital in Brunswick, Maine in their Outpatient Addiction Resource Center. Shirley, that was very helpful, learning about treatment for opiate dependence. Because none of us live in isolation, can you tell us a little bit about the family, significant other, and the community's role in promoting recovery?
Well, what I'd like to start with is that treatment does not need to be voluntary to be effective. Many folks come into treatment due to pressures from their family, pressures from their employer, pressures from the law, that they need to come to treatment and they're going to lose something. They're going to lose their family members, and they're going to lose their freedom and be incarcerated, or they're going to lose their job. And so the individual may not be motivated on their own at that moment, but that gets them through the door of treatment. So I just would like to say how effective that those other sources are, to have boundaries and set limits with the people that you notice are having an effect with whatever you're doing regarding their substance use, and to encourage them and prompt them to get into treatment. The statistics show that the outcomes of their treatment are just as successful as that person that came in voluntarily on their own. Once they come and they stick around because they need to, they don't want to lose something else, at the end of it they usually become engaged and they benefit in the same way. So I think that's important to just let families know, to continue to give your loved ones those messages that you want them to get help, and that you think their behavior is a problem. On the other hand, people, do need to set limits. Oftentimes they're having money and goods stolen from them, because to support these habits you need to have that money. And there really needs to be some limits and protection of themselves regarding somebody's substance use. So there's a real balance between support and boundaries and not enabling somebody. And if you're really struggling with that, I would encourage family members to go to Al-Anon or counseling or some kind of support to help them try to discern what is appropriate behavior for working with someone. It can be very disruptive to a family. So that's maybe how they can be helpful and where they can get into some trouble. Common concerns from family members when people do come into treatment is, what is this Suboxone or buprenorphine? A lot of families are just thrilled because they see the person's already been taking it from the street supply, and they've seen the change in them, and they're totally supportive. They see such a dramatic change, and so there's no problem. Other family members are like, understandably questioning, why would my family member get on another substance they're going to get dependent on? What's the help in that? It's a crutch, isn't it a crutch? And I guess our response is like, yeah, and they need a crutch. They're sick and they need a crutch. They need something to lean on right now. And that really is an individual's decision to make. I've never met someone who hasn't tried multiple times to stop using on their own before they came in for treatment. So usually the problem's severe enough that they do need that level of help. But talk with the providers. I would encourage families to get their questions answered. I hope some of those questions have been answered, during this presentation. But that is a common question. And some clients come in and they don't want it for the same reasons, and that's totally respected. That's great. That's a personal decision to make. Another question that comes up is, when can they stop taking this medication, or when can I, as a consumer of services, stop taking this medication? And that again is another personal decision. You do get dependent on the Suboxone when you come off of it, the buprenorphine. When you come off of it, there will be some withdrawal symptoms, but if you do it under a doctor's supervision, it's done very slowly and incrementally so that your discomfort will be minimized. And over a longer period of time. So it's not going to be the same as people going cold turkey and withdrawal at home on their own. So I think what we're finding after doing this for 6 years at, where I'm employed, a lot of people are staying on at maintenance. They're finding it's helping them so much, and they're functioning at such higher levels that they don't want to come off of it. And I think, you know, since this is such a new drug on the market since only 2002, we're learning at, you know, different trainings I go to that with other national presenters are talking about this could be a long-range medication like insulin for diabetes that people with substance dependencies are going to need to function. There'll be that population that can come off and that population that may need to stay on. And that's what I would say to family members. You know, we don't know how long they're going to need to stay on these anti-craving medications.
So Shirley, where can people get help? So someone may be watching today who feels that they need help and they don't live in Brunswick. Where can people get help to become well?
There are many, you know, centers around the state of Maine. Some are hospital-based, some are freestanding, where you can get the substance abuse counseling and also access to the medication-assisted treatment. And also there are the methadone maintenance clinics around the state of Maine as well. So we will be noting that at the end of this presentation on the screen so people can see where to access that information. Primarily going to their primary care doctor would be a good start, although I know many people don't want to tell their primary care doctor that they have a dependency. You know, they're embarrassed about that and they don't want any of their physician to have a change in opinion about them. You can also go to the Office of Substance Abuse website or call them and they can tell you about any resources in the state of Maine that are available. But there are so many that that would be a good central point to get that information.
You've shared some very helpful information with us, and it's a lot of information. Mm-hmm. If you were to leave us with a couple of takeaways, a few things that we should all remember about opiate addiction and dependence, what would you tell us?
Well, first of all, I'd like to say that there's hope. There's hope for treatment. I'm really concerned about the amount of overdoses that have happened just in the state of Maine on opiates, and combination of opiates with anti-anxiety medications and other medications that lower your breathing rate, and you know, many accidental, I would say mostly accidental overdoses. Just the message that there is hope, there is treatment available. If you don't have insurance and you don't have money, many of these centers have grant money that they can help support you to get treatment. To just know that there's help available and there is hope. You know, many people are recovering and in recovery from their addictions. The second message I'd like to wrap this up with is patience. The importance of patience and perseverance. That this is a disease. This is a chronic brain disease. Once you become addicted, you don't become unaddicted. Your brain has had some permanent structural changes. The families and the individuals, you're in this for the long haul. There's a lot of hope that you can have good periods of recovery, but just knowing there's always the risk of relapse, and there is no shame in coming back for treatment again and coming back to get help as you need it and as that occurs. And not to get overconfident when you're doing well, just to realize that this illness requires patience and perseverance and continued awareness of where you're at and in your recovery. And you know, I didn't mention 12-step recovery programs again when we talked about the community and what the community has to offer. Where they come in and are most important is after this treatment period happens, people can get through some physical recovery, but then how to live in sobriety. How do they live their lives in sobriety without thinking of drugs and alcohol as a means to solve their problems? Well, that's where the 12-step programs are so important, because they're out there, they're available to anyone. There's experience there of people in recovery to support the newcomers coming in a place to share about your addictions in a way where you're not being judged, you don't feel different than anyone in the group, and everyone is there helping to support each other in sobriety and in recovery. And they also have the 12 steps where people can learn about some of the character changes that have happened to them in their addiction and how to address that, how to make amends, how to deal with their own issues of shame, how to become a more fully developed person. So I think that's so important for community support as well. But the message of hope and patience and perseverance, I think, is a good way to end this presentation.
Thank you, Shirley, for educating us about the problems, treatment, and recovery for those who have opiate dependence and addiction. It was very helpful to understand it as a chronic disease, but you've given us hope despite the challenges. So thank you very much for your time and expertise today.
You're welcome.